Hello and welcome, everyone. My name's David Silberman. I'm the co-founder and CEO at Clinical Research Fastrack, and we have a very special guest with me today. It's Leia Wilkerson. Do you remember exactly when it was that you started with us at Clinical Research Fastrack?
Yes, actually, when I emailed you, I had to go way back down memory lane. I racked my brain. I remember it was literally, I think, November 2020, actually. I think that was my first class. And I remember just doing all the prep work to start the class and then getting ready for that week-long course. Walking into not knowing what I was going to expect coming out of there, not knowing what I was going to be learning, but eager and excited to just learn something new and start something so completely different than what I was doing currently.
Well, fantastic. So let's take a walk back. What were you doing before you came to our class, and what was your background, and what were you up to before you started with us?
So I had graduated college in 2018. From there, I had worked various retail jobs. I had just started working in insurance in 2019, I think 2018, 2019. Working for a really well-known insurance company as what was I doing? An underwriting service assistant. Just taking phone calls all day, doing claims, processing claims, adjusting claims, anything like that. And I remember it was just a mundane job. Wasn't any really fulfillment, no excitement, just a day-to-day job. And I remember my aunt was telling me about Clinical Research Fastrack. She's a CRA. And I was like, okay, like, what do you do on a day-to-day? She was like, I can't really tell you. So I think you should take this course. So that's when I signed up for the course. I got all the information. And was just really eager to start. And I just did not know I was going to learn as much as I did in that week-long process.
Yeah. Okay, so you had a bachelor's degree, you're working in insurance, and you're like, I want something more from my career. You wanted something more. Tell your aunt thank you because our
Of course.
industry thanks her because she referred you. So you enrolled in the program, and then what happened? What was your first experience?
Honestly, I'm gonna be completely honest. I was completely so nervous, like so nervous during the first class. You're amongst so many different professionals, amongst people that have gone to school, have gone masters, PhDs, people that have just bachelors, or people that are parent. Like you just have such a variety of students amongst each other. But nobody came in like they knew everything. Everybody was on one level. Everybody was so welcoming, and you could just tell everybody was eager and excited to learn as much as we could during that week.
Wow. So you're in the course, and do you remember you're on Zoom? How was it learning on Zoom? It's a whole new experience.
Yeah, I was definitely extremely nervous. But you all made it so welcoming, such a welcoming environment as far as everybody being on camera, everybody asking questions. It was very engaging. I couldn't imagine not doing this on camera, seeing that we were together for hours a day. But I think on camera helped. I think the small group sessions helped. Just getting to know each other before and after class truly helped. And all the connections that we made via LinkedIn and Facebook and everything such as that, it truly helped make those connections amongst the industry.
Okay, so then you completed the class, and what happened next? How did you get into the industry?
So you all actually have a great program as far as making sure our resumes are up to par, prepping us for interviews. I can definitely say you all did not leave us or forsake us when it came to preparing for interviews and questions that we may be asked. So it was really nice that I was able to go knowing I was prepared for any interview that you all were able to set up for me. And then as far as interviews that I was setting up for myself, so I was able to snag an interview with Icon as an in-house CRA. Oh, sorry, let me back up. I think I signed on with Emory Winship first. I had snagged a job with Emory Winship, and then at the same time, I was interviewing with Icon as an in-house CRA.
Okay,
And
wait, so you were interviewing at Emory Winship Cancer Center, which is in Atlanta's premier cancer
yes,
center. Did you start working with them?
no, so I literally gone through like all the background screenings, drug screenings, all of that. Got the badge. Was about to start, I think, like a week out. And I was still interviewing with Icon in the back end. And they were like, hey, we really want you. And I was like, so I was definitely pretty torn.
So basically you had multiple offers.
Yes.
You had a couple different opportunities. You're in that in-house CRA job for about 6 months, and then what happens next?
I got my first promotion to CRA1.
Okay.
So yes.
CRA1. And what kind of trials are you monitoring as a CRA1? That's a clinical
So
research associate.
yes. So during that time, that's when, COVID was very heavy. So I was then doing pediatric vaccine for COVID-19. So doing those trials, thankfully, one of my sites was located in Atlanta. So I was able to monitor here in Atlanta and not have to worry about booking a flight, booking hotels, or anything like that. But I was able to monitor here in Atlanta. And I think my other site was Orlando. So just kind of managing two sites, two vaccine trials, blinded, and learning how that works.
Another thing we talk about in the class, blinded trials.
Yes.
Okay, so what is your title now?
I am a regulatory research coordinator at Children's Hospital of Atlanta.
Okay, and how long have you been in that role?
For about 7 to 8 months now.
Okay, so you were a in-house CRA, a CRA1. Did you go on from that role?
Yes, I became a CRA too. Yes.
CRA, and what's the difference? CRA1, CRA2?
For CRA two, I definitely noticed I had definitely more sites. I was now juggling multiple sites, more like 4 to 5 sites, and that was blinded and unblinded trials. There I was able to start dabbling in unblinded trials, and I absolutely loved it. Absolutely loved it. And it's just one of those things that you never stop learning for sure. So when I thought I knew like, oh, everything has a CRA one, I became a CRA two, and you're learning even more. Learning never stops ever, for sure.
Wow. And then you were there for a while, and then how long? And you said you've been now at, is it CHOA? Is that it?
Yes, Choa.
Children's Hospital of Atlanta. And you said for about 7 months?
Yes, yes, sir.
Okay. And you're in regulatory. What does that mean? What do you do in regulatory?
Exactly. So I think that's why I made that transition. I really wanted to know what happened on the site side of things. It was nice being a monitor. It was nice coming in, making sure studies were running smoothly and reporting back, all those things. But I definitely wanted to see what was happening on the site side. I just wanted to dabble more into regulatory to see what was going on. So currently now I'm doing IRB submissions to local and external IRBs. I'm actually writing ICFs and protocols and adjusting things like such, updating new IDs that may come out, new amendments, anything of that sort. That is what I am doing, and translating documents into English to Spanish. So yes, now I'm doing lots of submissions.
Fantastic. Do you speak Spanish? I didn't know that.
Like not at all, but it's one of those things that we send documents off to be translated, and then we put in our boilerplate language that goes for our site, specific for our site.
What is it that you love about clinical research?
I would have to say the advancement of medicine. You truly see hope, honestly. And I think I've been saying that from the day I started. I just wanted to see, I know for sure, like my grandmothers were involved in clinical trials. And so it's just so amazing to see how you're just giving families and members and just people that little piece of hope that allows them to keep going. Medicine is truly evolving and it's truly making a shift each and every day. So it's just so nice to see that I'm helping do a little piece of that to encourage people to keep going. I may not have a big piece of that, but it's more like, when a vaccine gets approved, when a trial gets approved, when we see the effects of a medicine working, a chemo treatment, it's just so amazing to see that has actually worked. Like all the tests have done, all the clinical trials we've gone through, all the reports that have been written, updates, amendments, like that was not in vain. You're actually seeing medicine progress right in front of you.
That's beautiful. I love that. Okay, we're gonna do a little bit of a lightning round. Are you ready?
Okay. Okay, sure.
Favorite moment on the job?
Ooh, I would have to say all the travel. All the travel. I've never traveled the globe as much as I have truly as being in clinical research for sure.
Where's the coolest place you've been?
Ooh, I would have to say the coolest. For me, I would have to say Myrtle Beach. The views were spectacular, like beautiful. I could not beat that sunset that I would see from my hotel room
Wow, that's
for sure.
wonderful. Okay, and then another question, which is, you said what you love about clinical research, and this might be similar. What impact do you want to make? What do you want to be known for? What do you want to do?
Oh gosh. Oh wow. I guess more so paving a way. Paving a way. You think that there are no answers. We think there's a stop at some point with medicine, but I feel like medicine just keeps evolving. So I would love to just continue to make an impact, to improve lives, help others, just to be able to give back a portion of what I've been able to receive from clinical trials back to those families and patients that need that little piece of hope, that need that thing to keep going, to keep pushing, to keep striving, to know that, you know, there's a trial for everything. There's truly a trial for everything. You just have to find the right trial, find your right niche, find the right medicine that you want to get into to keep going. So yeah, evolving for sure.
Beautiful. I love that. And then, Leia, what advice would you give someone new who's coming into the industry?
Take your time. It comes. Things come, but nothing like that knowledge, that foundation um, of just learning. You're gonna forever continue to learn. No matter how seasoned of a CRA, no matter how seasoned of a coordinator you may be, just take your time. It's gonna come with time. The knowledge comes, the passion comes, all of that. Just take your time. Don't rush it. Take your time. Lean on your resources, network. But overall, take your time. Take your time.
Beautiful. Oh my gosh. That is awesome. Is there anything else that you want to share with people who are interested in clinical research or with the world?
Of course. I would say do it and do it scared. It doesn't matter what it is. I remember just sitting in class and just being absolutely terrified um, of just interactions and who I was going to meet going forward. But do it and do it scared. There's no shame, no fear in doing it and doing it scared, but you're doing it. You're taking the first step. You signed up for the course. The hardest part is done. Now you just got to go out, do your interviews, and do it. Just do it scared. That's all I can say is do it and do it scared for sure.
Leia Wilkerson, the Regulatory Research Coordinator from CHOA, Children's Hospital Atlanta. I want to thank you so much for joining me. And after 4 years, you've come so far, but I think you're going to be going very far from here.
Thank you.
So much to do in this industry, and you have a great future ahead.
Thank you so much.